Okay, hi everyone. My name is Harish. I am a final year medical school student, and I'm also part of the academia team at Intermed School. So this is going to be part of a series of presentations that we're giving on different conditions and different pathologies. Hopefully in order to build on your knowledge and some of the content that you cover in your A-level studies, but also to give you a taste, a flavor of things you'll encounter in med school and just how to work through different pathologies in a systematic way. And today we're going to be talking about chronic obstructive pulmonary disease, which is often shortened to COPD. So you can see hopefully on the screen, quick agenda. I'll just give a very brief introduction to the condition, and then we'll talk about the pathophysiology of it, some of the key investigations in order to diagnose it, and then how it's normally treated and managed, and then we'll have a quick summary at the end. Okay, so I know that you'll all be doing your A-level studies with different exam boards, and so you might not have covered the exact same content, but hopefully the respiratory tract is something that isn't unfamiliar to you. There's an image you'll see on the left here which gives a brief outline, a pictorial outline of the respiratory system. But the basic thing to know is that air enters travels through the trachea into the lungs. The lungs are the main organs involved in respiration. In the lungs there are these small air sacs called alveoli, which play a critical role in gas exchange, in taking in oxygen into the capillaries and helping to blow off carbon dioxide. And hopefully you'll also have a sense from your studies about the harmful effects of smoking. So in your studies you might have encountered things like tar, carbon monoxide, nicotine, all of these harmful chemicals that have a sort of damaging effect on human health and are linked to a number of different conditions of lung pathologies, and the most serious of which obviously being lung cancer. So COPD is a particular kind of respiratory pathology, and it's one that you will commonly encounter, regularly encounter when you're on the wards and throughout medical school. The main cause of COPD is tobacco smoking. This is because smoke and different chemicals that we spoke about on the last slide can have a damaging effect on the airways and on those air sacs on the alveoli. And we'll talk about this in a little bit more detail on the next slide. But although tobacco smoking is the main cause, the most common cause that you'll find, there can be other causes such as secondhand smoke or maybe chemicals in the environment. So if you go onto the ward, for example, and you see someone with COPD, what will they be presenting like? What kind of symptoms will they have? Well, mainly they will be breathless. They will be short of breath. They'll be finding it difficult to breathe. You might find them wheezing, and they might have a cough as well, a cough that produces phlegm. So those are some of the common symptoms you'll find in someone suffering from COPD. Okay, so what kind of effect does COPD have on the lungs? We said that it has this damaging effect on the lungs, and it causes people to become short of breath and have a cough. Why is this? Well, there are two subcomponents of COPD that are chronic bronchitis and emphysema. So we'll talk about each in turn. So take chronic bronchitis. In chronic bronchitis, what happens is the bronchial tubes, and if you refer back to the respiratory tract image, you will see that there were the trachea going into the bronchioles. These bronchial tubes become inflamed. Okay, they become inflamed, they become narrow, and they become filled with mucus. And what this causes is a blockage in these tubes. And that means that these people who suffer from this condition are coughing in order to clear the airways, in order to clear the mucus that is clogging up these tubes. So that is what happens in chronic bronchitis. There is a blockage because of inflammation and mucus. In emphysema, what happens is the alveoli that we spoke about, these little air sacs that are involved in gas exchange in the lungs, they become destroyed over a period of time due to the smoke, due to people smoking. And this leads to reduced airflow out of the lungs, because obviously these alveoli are involved in taking in oxygen. They are involved in blowing out carbon dioxide, but the amount of oxygen people are able to take in, the amount of airflow, is reduced when these air sacs are destroyed. So those are two ways in which in which smoking can affect the lungs and cause some of the symptoms that we saw in the last slide. Okay, so suppose someone comes in and they're presenting in this way. They've got these symptoms we spoke about. They've got a long history of smoking. You take a history from them and they say they've been smoking for several years, 20 cigarettes a day. You might think, oh, this person maybe has COPD. But how would you go about investigating it? What kind of investigations would you do in order to diagnose it? And you'll encounter this in med school, so I'll just talk about a couple of things. There's many other things you might do, but I'll just talk about a couple of them. One thing you might consider is a chest X-ray. A chest X-ray might show some signs of COPD, but very often these signs aren't visible in radiographic imaging. Especially in the earlier stages of the disease. But it can still be useful to order a chest X-ray, because what it can do is it can help to exclude other conditions. So there might be other respiratory pathologies, maybe a pneumonia or something like that, that you might think the patient has, which will show up much more clearly on a chest X-ray. You order it, you don't see those signs, you then excluded that, even if you haven't necessarily confirmed COPD. And that's something you will routinely encounter in medical school, is the use of imaging, not necessarily to confirm a diagnosis, but to exclude other potential diagnoses that might present in a very similar way, where the patient might have very similar symptoms. Another thing you might do is spirometry. And what this involves is the patient breathing into a machine called a spirometer. And there are two different measurements that are taken. One is the volume of air that you can breathe out in 1 second. So in 1 second, how much air do you breathe out? That is called the FEV1. And then there's the total volume of air that you just breathe out in total. So not in 1 second, but in total. And that is the FVC. And what they do is they take the FEV1 and they divide it by the FVC. And obviously the FEV1 is going to be a smaller number because the amount of air you breathe out in 1 second is going to be obviously less than the total amount of air that you breathe out. And what they look for is the ratio here. What kind of number comes out when you divide the FEV1 by the FVC. And if that number is less than 0.7, that is considered to be an obstructive condition and lends towards a diagnosis like COPD. So in COPD, this ratio will be less than 0.7. I don't want you to worry about that too much for now. As I said, you will encounter this again in med school, but it's just useful to know that you do a spirometry test. This kind of thing can help to confirm COPD. You might do a chest X-ray more to exclude other diagnoses, not necessarily confirm COPD, because the signs won't always be visible. Okay, so you've diagnosed COPD. How do you help these patients? How do you bring about an improvement in their condition? One thing you can do is give something called a bronchodilator. So what this helps to do is relax the airway muscles, widen the airway, and this can help to relieve the symptoms of coughing and shortness of breath and just make it easier for these patients to breathe. You might also give corticosteroids. So what steroids do is they reduce inflammation. They reduce inflammation in the airways. But when you're prescribing corticosteroids, it's also important not just to be aware of the benefits they can have in reducing inflammation and helping these patients breathe, but it's also important to be aware of some of the potential side effects. Now, steroids have a lot of side effects. The two common ones are bruising and making the patient more susceptible to things like oral infections. So you've always got to be watchful and mindful that medication that you give to help a patient might end up causing other symptoms and other problems. You can also give these COPD patients oxygen therapy. So in particularly severe cases when the patient is oxygen depleted, there may be the need for additional oxygen via mask or something else like that. In addition to the things we've already spoken about, you can also consider longer-term pulmonary rehabilitation. So what this means is when people are discharged away from the hospital, in order to reduce the risk of readmission to hospital and just improve the patient's quality of life when they're out of the hospital, there are rehab programs that are focused on things like patient education, exercise training, giving advice about nutrition. Obviously, smoking cessation is going to have a very important benefit for these patients and help to slow the progression of the disease. So these kinds of patient education and smoking cessation and exercise training and nutrition advice play a critical role in treatment as well, in addition to medication. Okay, so what are the key takeaways that I want you to take away from this presentation? Well, there's a couple of things really. Number one is to think in the order of causes, symptoms, investigations, and management. So the patient comes in, you take a history from them, you examine them, you think about what is causing them to have these symptoms. Why do they have these symptoms? Why are they presenting this way? Then you do some investigations. You might look at bloods, you might look at imaging like x-rays in order to confirm your diagnosis, and then you think about how do we treat them, how do we manage this patient. This kind of order of symptoms, investigation, management is one that you'll routinely encounter at medical school. So it will be helpful if you already start thinking in that structured way. And the other thing which we spoke about when we were talking about x-rays is to recognize the importance of using investigation sometimes to exclude other possible diagnoses. We spoke about excluding, for example, a pneumonia. By ordering an x-ray. Even if they don't necessarily have a pneumonia, they have another condition, the x-ray can be useful in excluding another potential cause. So that is the very quick presentation on COPD. Hopefully you found it helpful. Obviously, if you have any questions, feel free to get in touch with us, and I'd be very happy to answer any questions. But yeah, COPD is something that you will definitely encounter in your medical studies, and hopefully this has given you some sort of sense of what it is, and I'm sure you'll be able to build on it in your studies going forward. Thank you very much for listening.